the best residents and doctors are not the one who come with the answer right away, are the one actually who asked the right question.
Dr. Heval Kelli, how you doing, my friend?
Hey, how's it going?
It is going. I'm excited to be here, joined with 700 or so students so far. More will trickle in as we go. Here to talk about some fun cardiology, huh?
Yes. I actually have a case for people to engage. Can the people engage with us where they can ask questions?
Yeah, we can bring a couple people on. So if you're watching this and you want to come on and ask some questions and engage with this case, we'll bring two people on. How about that? And
so I can treat them like interns. I'll be there attending and I'm asking questions.
You're wrong. Go do a lap.
Exactly.
That is awesome. I love it. So let's just briefly, and I don't know what your presentation has, so maybe it covers this, but a little bit about just who you are.
Well, my name is Heval Kelli. I just finished my cardiology fellowship. I arrived this country age of 18 as a refugee and worked myself from washing dishes. I was such a bad dishwasher, I became a doctor, so no choice.
Nobody let me wash their dishes anymore, so I'm like, let me wash out your arteries.
Exactly. So I went to Georgia State, then Morehouse Medical School, and then Emory University for residency and fellowship. And I just literally finished in July, and I started a job in September here at Northside Hospital.
Nice. Congratulations on that amazing journey. I know I had you on the Premed Years podcast for people who want to go hear more about your story. Amazing story of resilience and just overcoming and living the dream.
Great.
So,
well,
let's go.
Let's go. Let me start my presentation. So can everyone hear me? You can hear me very well, and everyone else too, right?
Yep.
All right. So I always start with this picture, actually. So this is a picture of me and my brother, and we actually stand in a neighborhood we used to live. We used to live in a very poor neighborhood called Clarkson, Georgia. And, I became a cardiologist. My brother is finishing his general surgery residency, and he's about to start trauma fellowship in Michigan.
Wow.
So the reason why I saw this picture, we both came, he was 14, I was 18, to this country as refugee, didn't speak English. And the reason why I showed this because if I made it and my brother made it, anyone else can make it this way. I wasn't the smartest kid in my class. I was very hardworking. I took the MCAT twice. I think MCAT is the hardest test I ever took in my medical career.
Amen.
The second hardest probably my echo board, but that's took the MCAT twice, applied twice. I took a year off because I didn't have the money to pay for the MCAT and for that application. Realized later on that if you're underserved, you could actually get these things waived. So that's why mentorship and network is very important. So I tell people, like, you cannot be just a pre-med student in a room studying for your exam. You have to meet people because it can save you money and time.
Yep.
So this is my story. I just want to share this. Yes, you don't have to have a perfect MCAT score to become a cardiologist. And Emory University has one of the top fellowship program in the country. So they only take like 3 to 4 people a year from like thousands of applicants. So just to give you in mind. So you could definitely go and take the MCAT a couple times and still go to a small medical school at Morehouse and end up at Emory for fellowship. And I had no choice but to stay in Atlanta. So actually I interviewed at Hopkins and Brigham and all these other places for internship, residency, and fellowship. Because of my parents, I had to stay in Atlanta.
Yeah.
So I'm just giving you guys an insight. Don't give up on yourself.
Don't give up.
But doesn't mean go wash dishes now, though.
only at home. Only at home to help your family.
Exactly.
So right. A couple of people asking where you're from. You're a Syrian refugee.
Yes, I'm a Kurdish refugee from Syria. Yes, exactly. Yeah. I have a case for you. So actually in fellowship, I started a program called the Young Physician Initiative where we actually help people in our community to become doctors. And the way we do that is by inspiring them to believe in themselves, to go into medicine. So what I'm going to do is we do actually these cases with them. And these are high school and undergrad. We actually do a case. So the case is not very difficult. But the way we do these cases is exactly how you do in residency. To become an intern or resident, you have to. To become a resident, you have to do these ground rounds where I like present a case every morning, and the attending will ask you a question. So the way I'm going to do that, I'm going to present a case to you how we do that in residency. When you see a patient the day before, you present it to your attending, and they will ask you all these questions. So this is exactly the template. I mean, this is much more simplified than residency, but just to give you an insight.
Yeah. For those of the two students on, if you turn your video on, then you should be able to be here as well with us. And we'll.
What's your name? Sorry.
My name is Elizabeth.
Elizabeth, good. So I'm going to be the attending, presenting a patient, but at the same time, I'm also the patient too. So it's going to be a thing. I'm not bipolar. I'm just trying to play both roles at the same time.
Okay.
I just don't have
we have Amy here as well, but her video's not on. I don't know if she can hear me.
Hi, Amy.
Yeah, can y'all hear me?
Yep.
Yes.
Okay, cool.
Okay. So let's start this. Okay. We're going to play Think Like a Doctor. And of course, one of the funnest part of medicine is to think like the case of the volleyball player who passed out. We see this a lot. Passing out, or what in medicine called syncope, is the most vague symptoms we deal with as cardiologists. And it's very difficult actually to process that because sometimes it's nothing. Sometimes it could be something very dangerous.
Okay,
So,
I have an idea. I need to know first, what was the temperature during the volleyball game? Were they like playing indoor volleyball in a cool gym or outdoors beach volleyball on a hot day that's like 100 degrees?
This student's too advanced for us.
Well, they haven't, first part of medicine, you got to let the attending speak first to give you the first sentence. So, yeah, I don't know if they have sand volleyball in Atlanta. Maybe, I don't know. But so let me help you out. So again, funnest part of medicine to think like house. I think the beauty of medicine is actually, I know everyone wants to help people, which is great, but actually the power of medicine is the skill set when you walk into the room and go through a process how to diagnose a patient. The best residents and doctors are not the one who come with the answer right away, are the one actually who ask the right question. Because 99% of the time, the patient's giving you the answer if you ask the right question. So one advice to medicine, just listen first to the patient, ask the appropriate question. And when you ask the question, you should know why you're asking it to rule out and rule in thing. So let's play this game. Here we go. So I don't know about the sand volleyball part, but this is the lady, she passed out. Young lady, shouldn't pass out. She come to the emergency room and tell the doctor, hey, I just passed out for no reason. So, okay, what question you're going to ask? This is a chief complaint. So now you're in a room, you're the intern, the patient's in front of you. Let's imagine I'm the patient. So ask me a question about what's going on with me.
Okay, did you drink enough water? Like, were you staying hydrated during the game?
Yeah, of course. I mean, as volleyball player, we always drink water.
Do you have any pre-existing conditions?
No, I don't actually. What does pre-existing condition mean? Like, do you mean like I had acne?
Have you ever passed out before? Have you had any heart troubles or a history of seizures?
No, I never passed out. This was weird. That's why this is suddenly happening. I'm not sure what happened, and I passed out, and that's what concerned me. Someone told me my team, you're an athlete, you should get it checked out. So let me help you out. When someone has a symptoms, you have to ask the question about when it happened, duration, and the associated symptom. These are important because that's actually helping you. If it was like 1 second, was it 10 seconds? Did you hit your head? Those are important thing of the process, right?
Right. Do you know, were your teammates able to help you figure out how long you were passed out?
I don't know. Some people say for 5 minutes. It happened so suddenly. I don't know what happened though. I was just playing volleyball and suddenly I passed out.
Did the emergency responders tell you if they had to perform CPR or if you stopped breathing at all?
Yeah, I think if they performed CPR, it would have been intubated by now. No, I don't think so. I don't have chest pain, so if you worry, no. But what is CPR actually? What does that mean?
Chest compressions and breaths if you stop breathing. And
Good. The reason I'm asking you a question to go back to attending, because remember, a lot of your patients might not understand these medical terms. So it's very important to keep it simple, regardless of the education level. You want to talk to everyone the same level so you can actually get a good answer.
Okay, was it super warm on the volleyball field?
It's Atlanta, the weather changes all the time. So, but we played indoors, so it wasn't
Oh, okay. How long had you been running around playing volleyball before you passed out?
Maybe we were warming up actually, so it wasn't like we're going to the game, and that's why I'm scared. I was warming up and I wasn't getting to the game, and I just passed out.
Do you recall feeling dizzy at all right before you passed out?
A little bit, but it happened so fast.
And you've never felt like that before?
No, that's why I was very scared. I mean, I'm a pretty healthy person, but what I think my mom did, she talked to the emergency room team and they took some notes. Maybe she could help you because I'm still feeling kind of vague and dizzy. So let's look what my mom told other people what happened, okay?
Okay. That would probably be helpful.
Exactly. So let's find out. So 24-year-old female, they wrote down history of palpitation. So she does have actually, remember, people forget she's been having palpitation, which means heart racing on and off, and had 2 episodes of passing out. So the mom actually because remember, this person might passed out before but does not recall it. So the mom reports she had 1 episode last month and 1 today, and usually start with the heart racing few seconds and then black out. So the family told her she passed out for about 10 to 15 seconds. So whoever told her for 10, 15, 5 minutes was not correct. Both times occurred during volleyball practice. Was not shaking or foaming on her mouth, no weakness in the arm and legs, and no loss of vision, no chest pain or shortness of breath. When she said the mom, no shaking and foaming, what was she trying to tell you?
That it probably wasn't a seizure.
Okay, good. So again, like you asked the patient was still very vague, but the family member actually came and gave you a better story. So we now know the patient had this before, even though she might not recall it. And with younger patients, it's very hard actually for them to have good history. Believe me or not, they just ignore a lot of things. So the parents usually or the partners are very helpful to give you an insight. Anytime someone who passes out, I always call the partner if it was witness, because it does help you figure out what's going on. The person who has a seizure is not going to tell you they had a seizure, right?
Yeah.
All right. So the next question we ask, past medical history, right? So that's the next question. Like that's what you have. How would you ask someone who has no education about the past medical history?
Have you ever felt like your heart was racing, like beating really fast and it couldn't slow down?
Sure, but what I'm saying, like, how would you ask someone if they had existing condition?
I guess you could ask, have you had regular physicals in the past few years? Have you been prescribed any medications? Anything like that?
That's a very smart question, because some people like, do you have hypertension? Be like, no, and they own like 3 blood pressure medication.
That's a really good idea.
So the hypertension part, actually, people don't understand what hypertension is. What for them, maybe hypertension means like high blood pressure. The same thing with diabetes. For them, it's just something in the South we call, do you have the sugar? Like, so they don't understand what diabetes means sometimes. They're all actually on insulin. So you have to figure out from the medication what they could be on. What is the next question you ask after past medical history?
Family history.
Family is good. So how would you ask someone family history?
Do your parents or your siblings have any notable medical conditions, or are they on any medications? So kind of like a general medical history on the family.
Yeah, I don't remember. You have to ask my mom. I don't know. Maybe my grandfather or uncle had some issue with their heart, but I don't recall that. I'm not very involved with my distant relative.
Okay.
What other questions important to, like, especially younger people besides past medical history? What is the other thing you could ask them?
Their current lifestyle. Are they eating healthy? Are they staying hydrated? Are they doing any things that could deteriorate their health? Excessive drinking, that sort of thing.
What is that called, actually? Social history. So you ask them about, when you ask them about social history, yeah, the key top 3 things you want to ask is first, like smoking, alcohol, and drugs, right? Those are things, and then also about diet and exercise. So never ask a person, do you smoke? Because they say no. They might have quit yesterday. You should always ask, do you ever smoke? Because I had a patient told me they don't smoke anymore and they stopped smoking yesterday and they've been smoking for 30 years. So that's important to ask. What other question you could ask? Because, someone, like, if let's say you look at a patient and they have a scar on their chest.
Have you had any procedures before that had anything to do with your heart?
Perfect. That's important. You should always ask about surgical history, because they actually might not know that, but then like the family tell you, like, this patient at a young age had like some kind of surgery for their heart or chest. So that's important. So let's go through for the time being, just so family history is important. So you talk to the mom again. She said an uncle died suddenly, age of 30, and a mother had a pacemaker. So now you're getting some good history. Like there's some cardiac history, and anything below the age of 50 is considered premature. Something is the younger people happening. I know you might think 50 is old, but 50 is actually considered 50 and less considered very young in medicine. So just keep that in mind.
50 is old. Come on, people. 50 is nowhere near old.
Exactly. So again, in medicine, the cutoff is 45, 55. Yep. That's usually anything less than that is considered in cardiology premature.
Yep.
That's the word. The next thing is social history. So she told you she's a volleyball player. She drank 1 glass of wine. Used to smoke for 10 years. I don't know how she keep playing volleyball. Had palpitation for a past year. No drug history. The drug question is always tricky. People might tell you like they never did any drug, but you did a UDS. Usually in younger people, we're trying to do a drug screen test, especially if they have these symptoms. And sometimes when it comes back positive, you have to go back and talk to them about it. Be like, hey, your test came up positive. So keep that in mind. Anytime drug could be sometimes the cause of many issues in younger people than older people. But then I had also older people that had a positive drug screen test too.
Okay. It doesn't seem like the patient drinks enough for that to be an issue, but it could have something to do with the smoking. Like 10 years is a pretty long time to smoke.
Yeah, she was probably age of 14. And again, what is smoking? Did she just huff and puff on something during a party? That's important too. Like, it's not something like she's smoking every day. I would not assume that. So that's also another question to ask. So medication allergy, that's important to ask. So she didn't have that. So now you ask all these questions about from the patient. So that's you're kind of a detective. You got a story from the patient. You see what happened to them. You got some more history of the family. What is the next question? Now you move from the patient. What is the next step in like diagnosis process?
You smoked for 10 years. How often did you smoke?
I don't know, like twice a month, when they went to a party, they had some hookahs, like, the water pipe, and I smoked a little bit during a party. So I don't really smoke that often.
Are we allowed to ask for vital signs at this point since we have a pretty solid history?
Perfect. So that's the next step. Like now you move from subjective data to objective data, right? Subjective is like you're asking the patient, they're giving you a story, what happened to them. Now you're going to get to objective data. So what is the first thing you usually get from a patient?
Heart rate, blood pressure, oxygen level.
Exactly. So here's the vitals. Anything abnormal? I don't know why my thing does not show like the slides very well.
The heart rate's low.
Good. What else in the vitals? Anything abnormal?
The blood pressure is in the normal range, but just barely. It seems pretty low.
Good. What is after that? You look at the vitals, the nurse gave you a sheet. What else you do the next step after the vitals? So after the vitals, what is the next step? And like what do you do to the patient?
Start an IV for just making sure she stays hydrated to prevent if that's what caused her to pass out.
Wow, you're a very, very aggressive intern. You really want to go and get an IV in right away. What are the simple things? Simpler, like you got the vitals. What do you have to do? Like you have a stethoscope on you, right?
Listen to her heart.
Exactly. Examine the patient, right? You gotta have to examine the patient. So that's important. So this is the exam. You examine the whole patient. There's everything is normal except you hear an extra heartbeat. I'm not gonna go into like what it is, but you instead of hearing like 2 beats, you hear like a third one somewhere. It's not a skip beat, it's an extra heartbeat.
Extra heartbeat. Could the patient be pregnant?
Sure. I mean, but true. But by the time you hear a heartbeat from an infant, they should be showing some sign. But again, no, it's really not that you don't hear the baby's heartbeat that high in the chest technically. But it's a good question. Exactly. Any person at bearing age, you should always, like any woman who is not menopausal, you should always like ask about pregnancy. Actually, that's very smart to do that. But no. So, and it will make sense later on why she has extra heartbeat. Anything on the exam you want to do besides what I showed you?
I think it might be helpful to look at the heart, like with the ultrasound or one of those scans.
Sure, but it's not available right now to you. In the emergency room, they're trying to get vitals, they get an IV in there. Yeah, an echo is a good idea. But until the echo gets there, what else can you do after the exam? What is important? Like someone comes to you passed out, they have heart racing symptoms. What is a very important thing to get? Think simple. Don't think too complicated. Think very simple.
We need to make sure she has continued blood supply and oxygen supply to the brain and to other vital organs.
She does. She has a 99% oxygenation, good blood pressure. Heart rate's not bad. But what else? Like, think simple. Like someone coming to you with heart racing, passing out. What is one test you could get that's very easy in the emergency room?
EKG.
EKG?
Good.
Yep,
Good
sounds
job.
good to me.
So you listen to the exam. That's exactly it is. And before the EKG, usually you're gonna have some lab work, right? Some blood work. Like when anyone comes to the ER, when they get checked in, they check the vital, they draw some blood and send it out. Anything abnormal in the lab work?
Everything looks okay so far, but the platelets are in the normal range, but pretty low in that big range, so that could possibly be concerning.
So my advice to you in medicine, they have to be way off. Like when they give you a range, either they're below it or above that. And if it's below that, it has to be way below that too. So it's actually pretty normal.
Okay.
Yeah, everything looks normal to me.
What is a troponin?
Yeah.
You guys know what a troponin is?
Nope.
Out there from the bottom.
So a troponin. Sorry?
Isn't it a hormone of some type?
So troponin is actually a marker of injury to the heart. Most common cause when people have some kind of heart attack or heart injury to the heart. So that will go up.
Okay.
So hers is
there's
normal.
none of that.
Exactly. The other important one that you should pay attention to is the D-dimer. D-dimer is also an indicator for clotting. Just like something is clotting in your body. If it's like in the 5,000s and it's very high or like thousands, then it tells you like someone's having a blood clot somewhere. Why is it important when someone who's passing out and young, they in the D-dimer is actually like normal? That tells you this person might not have a pulmonary embolism or something like a massive blood clot that caused this issue. So when the D-dimer is normal, you could comfortably say what the passing out is not coming from a blood disorder or like a pulmonary embolism, pretty much. Does that make sense? So
Yes.
So I know in medicine, when I was a pre-med and medical student, I was trying to think like House, and I want to diagnose the case right away. That's not how it works, actually. The way House also does it, if you watch the whole show, he actually ruled out things. He gets lab, he crosses things off. Because that's not how it is. It eventually comes from like a list of 10 diagnoses down to 1 and 2. So that's how you should think about it. Like right now, you think, okay, the troponin is normal, this patient is young, less likely to have a heart attack. The D-dimer is normal, less likely to be a pulmonary embolism. So these two things. And what other thing is the patient has no fever and no white blood count? What do you think about when you see these things? Like if there's no fever, no white blood count, what do you consider?
Infection.
Exactly. So less likely to have an infection, right? Because she could have an upper respiratory infection or something like that causing all these issues too. All right, so let's go to who ready for EKG. So this is a normal EKG. But I want you to look at this EKG. Just look. This is what normal look like. And I want to show you hers. Anything different between the two?
Yes.
Yes.
What do you notice the difference? Like big difference. We look at 2 EKGs.
There's a big spikes in a
lot of the leads, right?
Yeah.
Perfect. That's actually pretty smart. You actually notice something there's huge spikes on the leads. That's actually going to make sense in the end. So good. Very smart. You're not going to tell as an intern to your attending, oh, there's huge spikes. You're going to say, you're going to say, all right, I see okay, we will go through it eventually. I'll tell you what it is. But right now you look at it, be like, well, this is not normal EKG for someone who's that young. So as an abnormal EKG. It's not a heart attack because the troponin is negative and the patient not having chest pain, but it's an abnormal EKG. Good. Good job. Very good job. Now the chest X-ray, right? That's another easy thing to get in the ER. It takes 10 seconds. Anything abnormal between the 2 X-rays?
It looks like there could be a little bit of a dilation of the airways, but it doesn't look a ton different, maybe a little bit.
Good. What do you think about the size between the hearts? Is they the same?
No.
Yeah, like why would a young, skinny girl have almost a heart looking bigger, right, than a normal X-ray, right? So that's kind of but you don't see here the airway where you look at them right now, they're all black, right? You don't see any white out or infiltrate. to worry about a pneumonia or a subtype of cancer, right? The airway looks good. That's what the black stuff, that's what air is. But then you look at the heart looks a little bigger, right? We're like, okay, that's interesting. She's an athlete. She shouldn't have a big heart like that. So that makes you worry a little bit. And remember, we also looked at EKG. She has big spikes. So big heart, big spikes, things does start making sense, right?
Would there be a previous medical record if she were born with like a congenital disorder with an enlarged heart or something? Or is that something we don't know yet at this point?
Sure, like, if like usually when they have issue at early age, sometimes these things don't get diagnosed because in the beginning they might not have any issue and stuff's like coming out. So that's a good question, actually. You could ask the mother, and then the parents were like, any issue when she was born. And the mom was very clear that she had no issue. She just had all these new symptoms of heart racing and passing out. All right, what else can we get after this? Anything else after the x-ray? Do you want to see the echo?
Yes, that would probably be a good idea.
All right, so this is supposed to be a video, so let me play it. So this is normal. So just to look at it, this is the heart. There's 4 chamber, right? The way you look in the echo is reversed up. Like usually the atrium, the top chamber on the top, but this is an echo, so it's reversed. So these chambers are the ventricle, the one on the top, and the bottom of the atrial. So this is supposed to be the video here. Do you see this now moving? So that's actually a normal moving heart. Usually a normal heart is moving about 55%. The heart never going to collapse 100% because it doesn't make sense with the flow. So that's a normal heart, actually. Now, in the other one, do you see the abnormal heart? What is noticed between this heart and this heart? What do you notice?
It looks like it's not moving as much.
Yeah, it looks kind of sluggish.
It's actually moving the same, but what do you notice that different between the two hearts? Don't you notice that this heart is actually a lot of like tissue in the end? You see like there? It's very thick, right? Compared to this one, it's pretty normal. Sorry, I have to stop.
So like a thickening of the ventricle walls?
Exactly. So that's actually true. Like if you look at, now this is not cooperating anymore because it's very slow, but see if you notice that, like let me play this. Do you see how this is actually pretty thickened in the top right here in the apex? That's what
I see that.
Yeah. Again, nobody's a cardiographer here. Like, of course, I don't want to expect anyone to echo, but you look at this one, how the wall is actually not very thick, right? It's pretty normal. Like that's how and the left ventricle is going to be thicker than the right ventricle. Why? Because the left ventricle is pushing everything against the body, right? The right ventricle pushes everything against the lung, because you get the blood from the body, deoxygenated, go to the right ventricle, and then the right ventricle pushes the blood to the lung to get oxygenated. And the lung is not actually high resistant, right? So the right ventricle doesn't do much of work to push the blood. Now the oxygenated blood comes from the lung to the left side, and the left ventricle has to do the entire job by pushing the blood to the entire body. So that's why if you look at an echo, the way you know something's the left ventricle is by seeing something that's very thicker than the right ventricle. That's how you know it. It makes sense physiologically. But in a patient, someone a 24-year-old, why would she have such a thick ventricle? So that's the question in all of the whole story. Here we go. So now your attending comes in and be like, hey, you've seen the patient. Give me a summary of what's going on with this patient. So you as an intern, what you end up doing, you end up going, seeing the patient, get all the data, and you come out of the room, and you have to present now to your professor attending about what happened in a few minutes to the patient. Any one of you guys want to do that?
I would just say we have a 24-year-old female, seems fairly healthy, normal vital signs, admitted to the emergency room after passing out during volleyball warm-ups, has had this happen twice now, passed out for 15 seconds each, and after listening to her heart, an abnormal extra beat was detected, and following a chest x-ray and an echo, it was observed that the heart appeared to be enlarged and the ventricle walls appeared to be thickened.
Wow. What are you, like an undergrad or a med student?
I'm an undergrad, yes.
I mean, that's amazing. I mean, to present to this level the way you did it, you have to go through med school 4 years, and you do 2.5 years of clinical at least. So
great job.
Huh?
She did a great job.
I mean, you could touch it up a little more, but at your level, you did as good as like a fresh intern, pretty much. Like, you did a great job. especially
I'm applying to medical school in 2 months, so I'm super excited.
Good luck with that.
You need to engage more with Ryan. You have a lot of smart student here. She presented almost at an intern level.
Yeah, that's good.
That was very good. So, okay, let's go. Good job. So 24-year female with history of palpitation, present with passing out during training, 10, 15 seconds each time, abnormal EKG, big heart. So differential diagnosis, what do you guys think is going on? So now you have to give me ideas. So you have all of these data and you have to tell me what's going on. Give me answer of what's going on with this patient.
Her heart is larger than usual. It probably has something to do with that.
Good job. So what else about the other person? What do you think is going on with her?
I think that there is a chronic condition here. I believe there's something going on with her heart that has gone undetected for a while, and it's just now showing symptoms. So I would lead toward investigating. I don't know all the heart disorders, but I'm leaning towards something of that nature where she has something significantly wrong with her heart that she's had for a while, and it's just now presenting, and that's why we're just now seeing the enlarged heart and hearing the extra beat. It was just something that just went unnoticed for a lot of years. I don't know if the smoking necessarily is contributing to it or not, but
great job. Both of you guys are actually on target. So when you look at something, be like, okay, this is not the brain. She didn't have a stroke. It's not the lung because she didn't have a pneumonia or a pulmonary embolism or a clot. And this is not something from dehydration, could be, but we're looking at this is cardiac etiology. Perfect. So now you actually have something to deal with. Good job. Actually, both of you guys were on target. Syncope, that's what she has. Syncope is a vague term. It means that's temporary loss of consciousness, usually related to insufficient blood supply to the brain, and is considered passing out. There are several serious heart conditions that cause this. Usually is bradycardia, which is slow heart with a fast heart rate, with an arrhythmia. So on her, interestingly, she has something called Hypertrophic Cardiomyopathy, which means, big name, means that you have a very thick left ventricle. Now, people could have this from high blood pressure or other condition, but usually a young person who presents with such a thick ventricle, you have to think about hypertrophic cardiomyopathy. Why? Because when you have a thick heart like that, the electricity of your heart might not be working well. So that's actually could cause a dangerous arrhythmia that people pass out from it. And that's why they have to go through some more testing. And most of the time, these people actually get the device for protection. Let's say if this happens again over time, because you don't know what's causing this, you could actually have to protect them depending on different criteria. But that's actually, when you see someone with a thick heart and young, you have to think about an arrhythmia causing these passing out. And the one thing that made her arrhythmia very dangerous, it happened suddenly. It was no aggravating factor. It wasn't like she was dehydrated, playing in the sun. Those things you have to worry about. You have to always rule out. But that was a very good way of diagnosing this patient, the way you guys came up with it. And at your level is more enough to say that, she has a thick heart, it could be a cardiac issue. And you can look up a hypertrophic cardiomyopathy. And it's true, it gets diagnosed sometimes later in age. We actually tend to get a lot of athletes who especially high school and college, and they get an exam, someone listen, they has a murmur, or they pass out. Usually they come see us and we get an echo and EKG, make sure everything's okay. But great job, guys. Good job. So here's the program that I have, is the ypiprogram.com. I started this fellowship. You can read about the program. We always have various events. But I think Ryan is doing a great job by offering us these sharing experiences. And this is my personal email. I do respond to emails. Now, I know there's 970 people of you guys on this.
Sucker.
So, no, that's fine. I mean, you guys, the two of you guys are great. You guys did a great job. So definitely email me if I could be helpful to you. And you can look up some of my work I do. But this is my personal email. I don't realize it's going to be 900 people, but that's okay. Definitely call me, email me for any question. Ryan, thank you so much. Any question anyone has?
I'm sure lots of people have lots of questions, but Heval, I know you need to go. And so what I'll do is I'll just do some Q&A for students to keep them on here for the next 30 minutes or so. So thank you so much for your time.
Thank you so much.
I appreciate it.
I know. Finally, good question. The treatment plan is different for each person. So again, this is a tricky condition, and it has to be seen by a cardiologist and electrophysiologist. So there's a multidisciplinary team seeing this patient. So true, there's different treatment plan for this, and it is very extensive to go into. But great question. That's something everyone can look up too.
Yeah.
Thank you so much, Ryan.
Thank you.
My pleasure. Have a great day, though.